Hey everyone, and welcome to our video on Chapter 12 of the Brain Resource Creation Workshop, which focuses on psychiatric disorders. We'd like to extend a warm welcome to everyone watching this video right now, and we thank you sincerely for your interest in this workshop. This presentation has been brought to you by Simply Neuroscience. It has been edited by Jed Q and edited by KCA. It's me.
This section of the presentation will focus on psychiatric disorders. There are two main causes of psychiatric disorders. The first being genetics, meaning it is hereditary and runs in the family. However, this is not the case for everyone. As the environment the person lives in also factors in. Environmental factors can include life circumstances, medical conditions, and personal relationships.
Post-traumatic stress disorder, obsessive-compulsive disorder, and panic attacks all have the common link of uncontrollable anxiety. These commonly occur in people with a history of trauma, which can be physical, emotional, or psychological stress. Anxiety disorders are most common amongst American women. This is due to the biological and psychosocial differences to those who identify as a woman may experience. Women are more likely to experience sexual assault, and sexual assault is more likely to cause PTSD than any other event. Medications that alter neurotransmitter levels are often prescribed to treat anxiety disorders. Selective serotonin reuptake inhibitors, or SSRIs, work by inhibiting reuptake of serotonin, which effectively increases serotonin levels in the brain. Another medication is, I'm so sorry, guys. Benzodiazepines. This medication works by enhancing the effect of neurotransmitter gamma aminobutyric acid, or GABA, to slow down the central nervous system and induces feelings of calm and drowsiness. However, the long-term use of this drug can lead to the development of tolerance, where the brain experiences an effect similar to that with alcohol. Throughout the presentation, we will discuss the above-mentioned anxiety disorders in greater detail.
This slide shows the common symptoms of anxiety disorders. This includes excessive anxiety and worry, fatigue, restlessness, increased muscle aches or soreness, impaired concentration, irritability, and difficulty sleeping. A person struggling with an anxiety disorder may spend a large majority of their day worrying about something when there is no specific threat present. This makes it extremely difficult to carry out everyday responsibilities and commitments, leading to long-term strains in relationships and work.
Obsessive-compulsive disorder, also known as OCD, is a mental health condition where a person experiences obsessive, uncontrollable, and recurring thoughts. Manifestations vary from perfectionism to worrying about being sick from a contaminated object. Compulsions such as excessive hand washing and continually checking for mistakes are often repeated and ritualistic that aim at counteracting said obsessions. Hoarding is a disorder where a person struggles to discard items for fear of losing or forgetting important information. Contrary to popular belief, those with OCD carry out compulsive behaviors to provide relief, not pleasure.
The disrupted signal between the basal ganglia and brain cortex leads to the ritualistic behaviors carried out by those with OCD. Medications such as antidepressants and tranquilizing drugs, counseling, and deep brain stimulation, which involves the use of electrode pulses to reset abnormal neuronal firing, are also commonly prescribed to those with OCD.
Here, we can see the difference between obsessions and compulsions. Obsessions may include contamination and losing control, whereas compulsions may include washing and cleaning and orderliness.
Moving on to post-traumatic stress disorder, or PTSD. This anxiety disorder is caused by traumatic events such as military combat, natural disasters, terrorist attacks, and incidents of physical or sexual assault. Oftentimes, symptoms can emerge after months or years of having experienced the traumatic event. These symptoms can include flashbacks, nightmares, memory loss, a lack of interest in activities, intrusive memories, hyperarousal, and guilt.
Not only can PTSD affect someone emotionally, But those who suffer from this disorder can experience physiological changes too. An increased heart rate, a heightened electrical sensitivity, sleep deprivation, triggered flight or fight responses to danger, and altered hormone levels are common physical responses to PTSD. Going back to the two main causes of psychiatric disorders, genes play a major role in PTSD.
Now that we're in the second half of the presentation, we'll be looking more closely into mood disorders. Major depression and polar disorder are disorders that lead to long-lasting mood changes.
There are 5 signs of major depression, and these include emptiness and sadness, loss of appetite, irritability, problems with sleep, and changes in appetite or weight.
Major depression is known to contribute to disability and death, accompanied by medical and psychiatric conditions such as diabetes, cancer, and addiction, which may be chronic. Genes, biological risk factors, environmental triggers, and psychological influences all play a part in the development of major depression. Major depression is usually developed in response to stress of difficult life experiences or disabling medical problems, such as this leads to the disruption of the hypothalamus and monoamine neurotransmitter systems that regulate dopamine and serotonin levels and essentially stress levels.
Major depression can also lead to a reduction in the size of the hippocampus and the prefrontal cortex, which have the function of managing stress. Antidepressants are often prescribed to those with major depression, as they're able to raise serotonin and dopamine levels. Similar to the treatment of PTSD, SSRIs, cognitive behavioral therapy, and deep brain stimulations are also used as treatment for major depression.
Bipolar disorder or manic depressive illness can lead to very intense mood changes. Those with bipolar disorder can experience extreme highs or manic episodes that lead to boundless energy, racing thoughts, and substance abuse, as well as severe lows or depressive episodes. Hypomania is a condition where one feels extremely energetic and highly productive. However, bipolar disorder is hard to diagnose and treat.
Here, we can see the difference in mood in manic episodes and depressive episodes.
Schizophrenia is a disease of cognition. It affects one for their entire life and causes major disruption in thinking, emotion, and behavior, leading to the loss of touch with reality. Positive symptoms include hallucinations, delusions, and confused thinking, whereas negative symptoms may include the inability to experience pleasure and a lack of motivation. Generally, schizophrenia is most common amongst those aged 15 to 25, as this is when the brain prefrontal cortex develops. Antipsychotic drugs can be used to treat calm patients, but there are often movement side effects such as tremors. Recent research has shown that 90% of schizophrenia patients are cigarette smokers, as this provides a sensation of relief. So, nicotine could potentially be used to treat schizophrenia.
The infographic on this slide shows how schizophrenia can lead to brain function changes in positive and negative symptoms.
Positive symptoms can include delusions, hallucinations, and disorganized speech. Negative symptoms include a flattened affect, reduced speech, and a lack of initiative.
Thank you all so much for tuning into this workshop on psychiatric disorders. We hope that you learned new things, and if you have any questions, please feel free to contact us if you have any at all. Thank you.